Hello, and welcome to the Chapter 21 Adult Daycare Training. This training is presented by the Oregon Department of Education Child Nutrition Programs, also known as ODE-CNP. Adult daycare centers provide a much-needed service to their communities. They provide meals to older and disabled adults who wish to remain in their own communities and avoid costly institutionalization. ODE recognizes that maintaining a high-quality, nutritious meal service for older and disabled adults requires a commitment to excellence on the part of caregivers. ODE applauds the many dedicated persons who ensure that adult daycare participants are served wholesome and nutritious meals in a sociable environment. The Adult Daycare Program is a subsection of the Child and Adult Care Food Program, the CACFP. That is available to operators of non-residential daycare facilities serving persons who are 60 years of age or older and functionally impaired adults. This training will cover the eligibility criteria for adult daycare sponsors, centers, participants, and meal reimbursement rates, in addition to the record-keeping requirements specific to the adult daycare program. By the end of this training, you will understand the criteria for adult daycare sponsors, centers, and participants to be eligible for the adult daycare program, the documentation required to determine adult free reduced price meal eligibility, and the record-keeping requirements specific to adult daycare programs. Let's get started. To participate as an adult daycare program in the CACFP, specific eligibility criteria must be met in the following categories: an eligible sponsor organization, operating an eligible center, serving participants who meet the program eligibility requirements. From there, approved adult daycare programs will be responsible for determining participants' individual meal reimbursement eligibility category. We'll start with the criteria for sponsor eligibility. CACFP adult daycare sponsors must operate primarily to provide daycare services to non-residential, elderly, and functionally impaired adults in order to avoid premature institutionalization. Types of organizations serving non-residential, functionally impaired, or elderly adults that are eligible to participate in the CACFP are government organizations or public entities, tribal authorities, private nonprofit organizations, some for-profit organizations that meet the criteria detailed in Chapter 19 for-profit programs, and residential facilities that serve meals to enrolled adults who live in the community and attend the facility for daycare. Please note that individuals who reside in the residential facility are not eligible for participation. Next is center eligibility. Adult daycare program sponsor centers must meet all of the following eligibility criteria: provide services to adults who are functionally impaired or over age 60, provide community-based programs that are structured, comprehensive, and provide health and social support services to enrolled participants, provide non-residential services, are licensed and approved to provide adult daycare services, and meet health, sanitation, and fire safety standards. Some examples include adult day service centers, support day care centers, adult day health centers, and licensed Alzheimer's daycare centers. Additionally, sites operated by for-profit sponsors must also have at least 25% of enrolled adults receiving benefits under Title 19, also known as Medicaid, to qualify for meal reimbursement each month. This differs from the for-profit participation criteria for other CACFP programs. Adult centers that are not eligible to operate the CACFP are centers that provide residential care with respect to those residential participants. This may include hospitals, nursing homes, residential centers for the mentally ill or for the mentally or physically handicapped, convalescent homes, apartment complexes designed only for functionally impaired individuals that provide meals and full-time care, and hospice programs. However, if a residential center also operates a non-residential adult daycare program, they may be eligible to participate in the CACFP serving the non-residential program only. Another type of ineligible center are centers for adults that simply provide social or rehabilitative services to frail and/or elderly adults, such as sheltered workshops, vocational or substance abuse rehabilitation centers, or social centers. After sponsor and center eligibility has been determined, centers then must identify participants who are eligible to receive meals reimbursed under the CACFP Adult Daycare Program. Eligible adult participants are adults who are 60 years of age or older, functionally impaired adults, regardless of age, that have an individualized plan of care maintained for them by the sponsor, and adults in one of the two previous categories who also reside in their own home or in the home of a family member, guardian, or other caregiver, or reside in a group home that is not a residential care facility. Functionally impaired adults are defined as chronically impaired disabled persons ages 18 years or older. This includes people who are physically or mentally impaired to the extent that their capacity for independence and their ability to carry out activities of daily living is markedly limited. Marked limitations refer to the severity of the impairment and not to the number of limited activities. They occur when the degree of the person's limitation seriously interferes with his or her ability to function independently. The CACFP Adult Daycare Program is not intended for drop-in adults who eat meals at a center but are not enrolled to receive care at that center, meals served to center volunteers, regardless of age, who help with the meal service or other center activities unless they are also enrolled at the center and meet CACFP eligibility requirements, participants who reside in a residential care facility, and individuals residing in an institution on a temporary basis for respite care, crisis intervention, or other reasons. Once the sponsor, center, and participants have been determined as eligible for the adult daycare program, the meal reimbursement eligibility must then be determined. As with all daycare center programs, adult daycare centers must annually determine participant eligibility categories of free, reduced price, or above scale. One way these determinations are made is based on income information provided by the participant or caregiver. This information is collected on the adult version of the confidential income statement form provided to the participants along with the adult version of the letter to the household document. General information regarding how to determine participant eligibility is covered in the Chapter 3 Determining Eligibility training, and this training will focus on aspects of eligibility determination that are specific to the adult daycare program. For applicants submitting income information on a confidential income statement or CIS to determine eligibility, only the income of the participant's spouse, and the dependent children who reside with the participant, if applicable, must be included. A functionally impaired adult participant living with his or her parents or guardian and caregiver is considered a household of one, and only the participant's income is used to determine eligibility. For adult daycare participants specifically, the confidential income statement form should be signed by the primary wage earner responsible for the care of the participant. This could be the participant or the participant's parent or the guardian living in the participant's household. As required for all program confidential income statements, the last 4 digits of the individual signing the form's Social Security number or an indication that they do not have a Social Security number must be documented for the form to be valid. On a case-by-case basis, if the participant is functionally impaired and cannot sign a confidential income statement for themselves, and a guardian is not available to sign the confidential income statement, and the participant's file has documentation that they are categorically free eligible, then a case manager at the center may sign the confidential income statement form. Sponsors may not use this method for approval for all participants, and if a participant is not free eligible, then the confidential income statement must be signed by the participant's guardian, or an adult household member. In addition to household income information, free meal eligibility can also be determined based on participants' inclusion in one of the following free eligibility categories: being a member of a SNAP household, receiving assistance under supplemental security income, which is specific to adult participants, receiving assistance under Medicaid or the Oregon Health Plan, or receiving food assistance through the Food Distribution Program on Indian Reservations program. Adult participants who are categorically free eligible must provide a SNAP or FDPIR case number or SSI or Medicaid Oregon Health Plan Assistance Identification Number on the confidential income statement. When this information is provided on the confidential income statement, the adult member signing the confidential income statement is not required to provide the last 4 digits of their Social Security number. Documentation of a legitimate benefit number can be documented on the adult confidential income statement or for adult daycare programs on the participant center enrollment form if the form is signed and dated by an adult member of the household. Like the confidential income statement, the participant center enrollment form is required to be updated annually to adhere to the yearly update requirements for income eligibility. Let's do a quick knowledge check on eligibility requirements before we move on. True or false? If a participant receives Social Security disability benefits, this qualifies him or her to be categorically free eligible. If you answered false, you are correct. Receiving Social Security disability benefits are not based on financial need like supplemental security income and do not qualify a participant as categorically free eligible. Well done. Now, let's review the CACFP record-keeping requirements for adult daycare programs. Along with all standard CACFP record-keeping requirements outlined in the CACFP manual trainings, adult daycare programs have additional specific records that they are required to maintain. This includes center enrollment documentation for each adult participant that documents the participant's age and enrollment in the center, since a child enrollment form is not applicable. Records on the age of each enrolled participant, which may also be captured on the center enrollment form. Documentation that eligible participants reside in their own homes or in a non-residential care group living arrangement. Records showing that each participant under the age of 60 meets the functional impairment eligibility requirements established under the definition of functionally impaired adult, and individualized care plans for functionally impaired adult participants. If you have any questions regarding what records are required, please reach out to your assigned child nutrition specialist. The individual plan of care is a written evaluation of a functionally impaired individual's health and social needs. It must include the goals and objectives of the planned care, the activities that will be completed to achieve the goals and objectives, recommendations for therapy, referrals to and follow-up with other service providers as needed, and provisions for periodic review and renewal. Once an initial assessment is completed, a plan can be developed to meet the participant's needs. The plan should include a daily schedule of individual and group activities aimed at providing both physical and mental stimulation to the functionally impaired participant. It must be a structured, comprehensive program that provides a variety of health and social and related support services to enrolled functionally impaired participants. In this training, we have reviewed the criteria for adult daycare sponsors, centers, and participants to be eligible for the adult daycare program, the documentation required to determine adult free or reduced price meals, and the record-keeping requirements specific to the adult daycare program. ODE supports equity and excellence for every learner. This institution is an equal opportunity provider. Thank you for taking this training.